Welcome to Tuesdays for Nurture. Tuesdays for Nurture are webinars from the United Church of Christ, which we faithfully focus on education for the people of God. Topics from faith-filled politics to how-dos in the congregational life to the impacts of current realities on the life of the church are featured. Each webinar will include clear suggestions on what you can do to change the church and the world towards the world God imagines for us. Buen dia. I am Roberto Ochoa, the Associate of Congregations of Color and Ethnic Identified Congregations, and your host for today's program. Today, we are pleased to have Reverend Traci Blackmon, UCC Associate Executive for Justice and Local Church Ministries, and Dr. Nicolette Louissaint, Executive Director and President of Healthcare Ready, a 501c3 organization that focuses on strengthening the United States healthcare supply chain preparedness and response before, during, and after natural disasters and disease pandemics. Dr. Louissaint will share with us the current state of the virus and vaccination nationally, as well as consideration for community re-engagement and long-term recovery post-vaccination. Reverend Traci, I pass it to you.
Thank you very much, Roberto, and welcome everyone who is joining us today for this very important webinar. I was just sharing with Dr. Louissaint before we came on how we have been hearing so much about COVID over these last 15 months. We are now very close to 600,000 deaths in the US just from COVID. And I don't want to minimize that while we've been dying from COVID, we've also been dying from all the other reasons that we die. So the amount of grief and the amount of death is inconceivable, at least for me. Just COVID alone represents more deaths in these last 14 months than we had with World War I, World War II, and the Vietnam War combined. And we are not a nation unto ourselves. We are a part of a global community where over 2.8 million people have lost their lives to this virus. And even as we speak right now, our prayers and our concerns are with India, where people are dying every hour. We are in better shape, my friends, in the US, but we are not out of the woods. And when I thought about someone who could talk with us about the current state of COVID and life beyond COVID, I could think of no one that I respect more than Dr. Nicolette Louissaint. I've had the privilege of hearing her talk about this virus and its impact on us in social context in ways that I have not heard anyone else say. This webinar is not simply about the medical impact, but it's about the social impact, the economic impact. And dare I say, from where we sit, there is a theological impact to what has happened to us during COVID. So welcome, Dr. Louissaint. We are so grateful that you are here. Please continue to put in the chat where you're coming from. Please put in the chat or in the Q&A any questions you have, and we will entertain those at the end of our lecture time. Welcome, and I'm going to just pose a question and invite you in. What shall we say about these things? What is the state of COVID in the United States in particular at this moment? Having access to the vaccine, how many are not getting it? How far are we from herd immunity? Will we reach herd immunity? What are our next steps and beyond?
Thank you so much, Dr. Blackmon, for having me. It is always an honor to be with you. Thank you so much for the invitation and to have a space for such an important discussion. I'm so thrilled to see in the chat so many people chiming in and sharing where they're coming from and where they're listening from. And I just want to wish you all well. I hope that you and your families are safe and doing well in this difficult time. And I recognize and lift up the important work that you all have been doing to maintain the spiritual well-being in such a critical time. And so I thank you for your service. As we are looking at where we are in COVID, and I have a few graphics that I'd love to share. If you are not able to look at them, it is perfectly okay. I'm speaking to everything that I'm going to say. But as we're thinking about where we are in COVID, I think one of the most important things to remember is that COVID is not happening in isolation. And so as we think about the last year and the months ahead, you've raised some very important questions. The first of which is, how are we doing on vaccinations? We are seeing that right now the response picture is focused on a few things. First is thinking about what happens if we can prevent infection. How do we do that well? And that's where the vaccine comes in. There's another question, though, now that we actually have the ability to help people not get hospitalized, sicker, or potentially die from COVID, which is, how are we making sure that the monoclonal antibody treatments that are available and in every state can be made available to those people once they test positive, because we still are very far away from herd immunity. And then there's a question of thinking about where the disparities are really coming to a head, because so much of this response was set up as a state and a local level response, which means that if your state actually centered equity and had resources, then you saw a more equitable response. And if your state did not, then you saw a more inequitable response. And so how we are tracking measures of disparities, how we are tracking uptake, and how we are doing the work of not blaming people for not taking the vaccine and using that as an excuse to not do our part to make sure that everyone who wants a vaccine can get one, is a big part of the road ahead. But while we're doing that, we do have to make sure that we are planning for what we're calling recovery, but is really a very long arc of how we continue to take care of each other in the next phases and how we gradually move to some version of normalcy. And when we think about, health broadly, it's easy to just say, what do we think, what does healthcare need, and think about a hospital. But really, there's an entire ecosystem that is going to be responsible at the community level for the physical and mental well-being of an individual. And what we're continuing to see when we look at it that way is that everything is still strained. Now, they're not strained as it relates to like N95 masks and gowns and gloves as they were this time last year. And that's fantastic. And we've all worked very hard to make sure that that's not the case. But we have healthcare workers that have been working long, hard hours in a very complicated environment to be able to deliver care, to be able to provide that psychosocial support, to be able to deliver therapy, to be able to make sure that prescription medicines have been dispensed, to make sure that long-term care facilities have the staff that they need. And they're stretched. Mm-hmm. And the needs are not stopping. So it's, for me, that is a part of the system that I'm very concerned about, are the people that are required to allow these systems to operate. And so when we look at it from Healthcare Ready's vantage point, we always look at the lens and the intersection between social vulnerability and medical fragility. And to us, it's very important to understand that neither one of these things happens in isolation. These are not separate phenomena. But it does mean that when we are thinking about who we prioritize in terms of who needs to get access to the vaccine, should they want to take it, we have to look at the lens of who would be most socially vulnerable, who does not have the ability to work from home, who has insecure housing, who would not be able to present identification or healthcare insurance to, if they needed to, in order to qualify them for the vaccine.
Dr.
But
Lewis,
also,
I
yes,
want to ask you a question because it's just us. And so I want to kind of go with questions in between, if that's okay with you,
sure.
so I don't get backed up. One of our listeners, Janice, has this question, and I will read it to you. It's more of a statement, but I think there may be other people that are in this position. She shares that I'm in a position with COVID that I lost my job, and with being an older worker, and now I cannot seem to find employment in any field because of my age and disabilities. So I get frustrated that employers are crying they don't have employees, yet I have applied and I'm rejected because I'm not young. That's one issue that we can't address here, though my heart is with her for that. So now that I'm out of health insurance, I'm scared to get the vaccination, as if I get sick, I have nobody and no income or health insurance to care for me. I want the vaccination and employment, but if I get sick from the vaccination, I won't survive because I don't have health insurance that will get me care. I was wondering if you had any wisdom about that.
Absolutely. And that is a situation that a lot of individuals are in, and my heart goes out to you. I know that that is um, a difficult situation to navigate. I will also encourage you, depending on what location you're in, the 211 system is actually designed to assist with some of the needs that you highlighted in your question. And so I would encourage you to stick with it. It may take a little bit more patience, and you may have to stay on the line and, you know, share your story, but there may be supports that are available for you if you do make that call. When it comes to so what I'm hearing, and I want you to correct me if this is not correct, is the concern about the reaction to the second dose of the vaccine, knowing that for many people, if they do react to the vaccine, that second dose for the vaccines that have two doses could be severe. There's also the other part of that in hearing you say you don't want to be sick from the vaccine. If there's an adverse event, if there's some sort of event that happens to you because you react poorly to the vaccine. In terms of coverage, should you have an adverse event and you needed healthcare, that would be covered. So I do want you to understand that would not require you to pay out of pocket for that care. Because this is still a federally run program, and all of the care associated with anything related to the federal rollout of the vaccine would be covered under the federal government. If you are thinking about the second dose, and this is where it gets, this is where it gets to a personal decision and how that second dose may feel for you. I would encourage you just understanding things that I wouldn't know personally, your age, what your health conditions are, to talk to people that are connected to you to see what their responses have been. I would be happy to share my contact information if you do want to talk about it a little bit further. If you do have a doctor that you trust or a pharmacist, you can ask them what is reasonable for you as an individual to expect. And what I've seen generally, my parents are above 60 and recently got vaccinated. My dad was fine. He is a diabetic. My mother is hypertensive, and she was a little sleepy. But I did advise them before they got the dose to do two things: make sure they were hydrated, and to take Advil or ibuprofen, just to take something that would help their body to manage the immune response. As you weigh the risks and the benefits, it's important to understand, and as someone who has many people connected to them who are either uninsured or underinsured, the question of the vulnerability that you feel when you know that you do not have health insurance, and the risks that you feel you may need to weigh. It's important to think about what happens if you go back into the workforce. So that is, again, a personal decision you have to make. But if it's about the reaction to the second dose, you may be sleepy for a couple of days, but you may be safer and feel safer going into the workforce if you are vaccinated, because if you do get a job that requires you to leave your home every day, then you would want to know that you're protected.
She's responding to you saying thank you.
You're welcome.
I want to just weave this other question in that's in the Q&A. And please, those who are attending, if you have questions, put them in. And when there are breaks, and I think it's appropriate, I will ask them as we go so that it's cohesive. Around the social vulnerability and medical fragility, a large part of the audience today are going to be ministers or congregationalists in some kind of way. And so we have questions about practical things, and I know that you have practical answers, so that's why I asked you. Two of the questions are about reimagining church post-COVID, right? And so many of our churches, many of our conference leaders are formulating their regathering plans for church. And there's this huge question, now that we have vaccines, what do you say about music? Do you still need masks to sing? Are people able to sing in congregational singing during worship?
I think it has a lot to do with ventilation and how your church is cleaned and what type of environment you can maintain. I think that's going to determine how the music ministry can do business. If you are in a church and you know, growing up in churches my whole life, I know that if you've seen one church, you've seen one church. When it comes to the size of the music ministry, where the music ministry is standing, how close they may be to the pastor, all of those things are going to be factors. So what I would consider is how you're able to space people out from one another. How you're able to do things like clean and sanitize the microphone. So would one person have a microphone for that day, and they're the only ones that are using it, and when they put it down, it's able to be cleaned properly until the next service. Those are the sorts of things that you want to consider. Are you able to make sure that the spaces, that folks are spaced out and that the space is ventilated well enough that you know that the airflow is going to move constantly? That's going to be a big determination as to whether or not you need to keep people masked, because really what you're doing with the mask is you're making sure that any type of droplets that may be airborne are being restricted by the mask. So if you are able to control that environment in those ways, a mask may not be needed. But if you have concerns about the ventilation, or you are going to be switching microphones, you may want to consider keeping them masked.
And what about if you're outside having worship, Dr. Louissaint? Larry is suggesting here that even when you're doing outdoor worship, there are precautions because musical instruments and singing is not really understood by most people. And so the ability of any kind of virus or contaminant we have to travel, even when we are outdoor worshiping. What do you say about that? And do you think we will be doing this for some time to come?
Yeah, I think we will be doing this for some time to come. I do think this is going to be for at least the next year. I think these questions are going to be in our minds, and the ways that we take these precautions are going to be in our minds. But I also think one thing that is unintended that's very good that comes of this, while these are disruptions, think about how few people have been hit with a really hard cold in the last year. So some of these precautions are keeping us healthy in other ways. I still think how we are thinking about the microphones, the additional assistive devices that we're using are going to be really critical, even in an outdoor service. I think the churches that have been able to make sure that they are keeping one microphone per person and that they are doing a solid disinfection of that microphone after usage have seen that they are able to be more confident in the safety of their protocols. Being able to make sure, again, that people are spaced out or that they are vaccinated themselves is very important. My own church is doing something where 6 or so of the members of the choir are standing socially distanced. They are singing unmasked, but they are within the church, and they're doing that. But they are also doing it where they're actually using the standing microphones so that they're collecting noise rather than having people hold them and put them in closer proximity to their mouth. So I think the principles are around making sure that you're not creating a situation where you're handing off a microphone or handing off materials to one another. And if they are vaccinated, you know that they are protected, but you also want to make sure that anyone that could be in contact based on droplet spread or airborne spread is protected as well.
So what about congregational singing? What if it's not a choir? What about congregational singing?
It is, I think it really comes down to space and ventilation. It's really about the ability to make sure that in instances where you can make sure that people are spaced out and that you are keeping that airflow going and that there are proper filters on the vents, that's going to be the key. So for me, it comes down to how many people can you safely have in that space to make sure that you are able to maintain that flow, and how do you make sure that not just between services you're able to get that cleaning. You really want to make sure that you're in an environment where you're able to use fans and make sure that the vents are working and there are HEPA filters that are on those vents, because you want to make sure that the air is moving and that anything that's in the air is being trapped in those filters.
Okay. I'm going to ask you one more question, then I'm going to let you continue, because what I hear people, perhaps there's a little bit of confusion here. If you have the vaccine, then the thought is that you are no longer able to transmit the virus through singing, through talking, through breathing, right? I don't know that that's true, but that is the assumption. So if you have been vaccinated, is there a reason in congregational context for you not to be singing in congregational style? Or,
if you have the vaccine, you are protected. And you are not protected from being infected with COVID with the current vaccines. You are protected from being very sick or being made sick if you were infected with COVID. And so what that means is that if you are vaccinated, the goal is that you make sure that you are not inadvertently infecting anyone else. And so if you are vaccinated, you being protected from being sick, you could actually still be what's considered to be a carrier of the virus. And so if you are a carrier, that means that you could have COVID, not know it, and you're singing, you're shedding virus, you're shaking hands, you're shedding virus, you're talking to someone, you're shedding virus. So it's still important to make sure that if you are vaccinated, if you know that you're going to be around interacting with people who may not be vaccinated, that you still get tested. I actually take that precaution myself when I know that I'm going to be in a space with many elders. I may not know their vaccination status. I don't want to ask it. So knowing that I am vaccinated, I do get a test to make sure that I am not carrying virus.
Okay. So Suzanne has put in the chat from the Center for Congregational Singing. She said they just had an update on their study, and they are suggesting that you must sing with a mask on until 80% vaccination is reached in the entire US population. We're a long way from that.
We are a long way from that.
Yeah, we're at about 30%. I think she says 31% here. So that's in the chat for those of you who need it there. I don't see anything else right now, so go ahead and continue, Dr. Louissaint.
Yes, so that is a great point, and that 80% number reflects to those questions on herd immunity. We keep hearing about herd immunity, and we also hear this idea of when are we going to reach herd immunity in the United States? And the truth of the matter is, you can reach herd immunity as a nation, but you really reach herd immunity. True herd immunity is global because we are all interconnected. So that means that what's happening in India and India's ability to make sure that they are able to vaccinate their population to 80%, and South Africa's ability to vaccinate to 80%, is all a part of this global community. And so we are a while away, and it's going to take us a while to get there.
I heard someone in a conversation I was in recently, it was a preacher, and she did a take on herd community to say not just herd HERD, but herd HEARD, right? So if we are listening to the advice that we're being given, we'll know that even if we're vaccinated, we have a responsibility to people that are not ourselves to do all we can to help protect people.
Absolutely. And, I saw a question come in asking about, the future of vaccination needed for variants for unvaccinated people. The tricky part about herd immunity and how we vaccinate and what this vaccination rollout is that it's so dependent on human behavior. This is the largest group project that we will ever be a part of. And so when you think about what it takes to get to herd immunity, so much of it, there's certainly parts that depend on the system, but so much of it depends on people. It depends on how we make sure that we are sharing vaccines that we have globally. It depends on how we are able to make sure that we are not just taking vaccines to people, but bringing people to vaccines. It also depends on how we communicate what we know about the vaccines, their safety, how they've been tested, what we know about what people should expect post-vaccination, in ways that make people comfortable getting vaccinated. And the longer it takes for us to do that well, the harder it's going to be for us to reach herd immunity, because the reason that we're seeing these variants is simple. Because we are allowing the virus to continue to infect people, the longer it continues to infect people, the more it's going to mutate. A virus's sole responsibility is to find a host and continue to be able to infect that host. Viruses cannot live outside of us. And so without having a host, it dies. That's how viruses work. They're not living things. They infect living things to be able to pull resources, energy from them. And the longer we are allowing COVID to actually circulate in our society, the more it's going to mutate, because it's mutating to be able to stay viable, to be able to continue to infect us. So when some of us are vaccinated I think we're between 30 and 35% right now for the US. Some of us are vaccinated and a lot of us aren't. That gives us space. And that space is where COVID is able to go in and say, how do I mutate so that I can continue to infect people? If we were able to vaccinate everyone at once, which is not possible, but if we were, we wouldn't see the types of variants that we're seeing right now, because all of those variants are about COVID trying to be able to continue to infect us and continue to survive.
So Dr. Louissaint, can you talk a little bit about, I haven't seen this written. I just saw it in a news report and I want to check it. Can you talk a little bit about vaccine hoarding in the US? If it's true that we have so many million doses of vaccine that are above what we need if everyone got vaccinated here. And I look at the global condition, I have questions about that, ethical questions, theological questions about why we would not be sharing our overflow.
Sure. So we have about 300 million American adults in the nation. And the strategy for the administration, and I will say the European Union did something similar, and there's something there that we should talk about. But they wanted to make sure that the vaccines that were available, that they could basically pre-purchase vaccine that would be made, knowing that they would have vaccine to vaccinate every adult in their population, with some acknowledgement that not every dose is going to make it. So you need a certain percentage for waste, let's say 5% or what have you. And so what you saw was the United States procured about 400 million doses. They're not sitting anywhere. So what's happening is they're basically saying, I'm paying this money so that when they're produced, they come to us. So we're not sitting on any vaccine. It's almost a pre-purchase model. And that's why we have 3 vaccines that are approved in the United States. One from Pfizer, one from Moderna, one from Johnson & Johnson. In Europe, there's a 4th vaccine that's approved, which is from AstraZeneca. The US had pre-purchased AstraZeneca vaccine, but because it's not yet been approved in the US, they hadn't applied in the US. That actually has been moved to countries that are willing to accept it. And that was about 60 million doses. If we were in a global community that always behaved as a global community, we would have a World Health Organization that has a facility set up to make sure that the world is able to get vaccinated, and would do the work of making sure that every single one of the 194 nations on the globe got the vaccine that they need. But because we don't have that, we have some countries that are working bilaterally. We have some countries that are working in consortiums, and then we have some countries that are working with the WHO. And so even at a global stage, we're not doing this in a way that's cohesive enough to set us up for success. So you've got countries like Brazil that is working with China because China has a vaccine as well. You've got other South American countries that are accepting vaccine from Russia, and then you have these vaccines. So what the US has done, I understand from the vantage point of wanting to make sure that every adult American gets vaccine, but I do think what we also had to do, and I think the decision to release the AstraZeneca vaccine as quickly as possible was the right one. I think we have to be very intentional about making sure that any of our technology, any of our vaccines, and any way that we can use US resources to help the globe is used right away, and not when it's just at the point of India, for example, where India's entire healthcare system has been completely broken by the pandemic. We have to do it in advance.
So you were involved in how the US addressed Ebola.
Mhm.
You were involved in how the US responded to Katrina, which
Mhm.
was not a virus, but was certainly a tragedy. You have had experience with how we as a nation respond to such crisis. What do you hope that we have learned in this pandemic? And how do you hope we might apply it
Mhm.
post-pandemic?
You know, I think about Hurricane Maria and the response to the 2017 hurricane season almost every day. Because, you know, we talk about Maria and we don't talk about Maria enough, very honestly, but we often forget that Hurricanes Harvey and Irma also decimated parts of the United States that are still recovering in very real ways. And so you don't have to look that far to see how critical it is that we are thinking about and planning for disasters day in and day out. Just in the last 4 or 5 years, we've seen a number of catastrophic events. Um, I have a number of hopes, but one of the most fervent hopes that I have from this is that we are not only thinking about and talking about disasters when they're happening, because the truth of the matter is that the reason that we call them disasters and the reason that we have to mount these trillion-dollar responses is because we did not have the infrastructure in place and we were not prepared to deal with it when it came. You think about it, if we have a Category 5 hurricane that comes into Florida and nothing is destroyed, it's a weather event. It's not a disaster.
Mm-hmm.
If people can stay in their homes and everyone has power and healthcare keeps running, it's just a weather event and we go on like any other rainy day. But it's a disaster because the systems that are designed to protect people and protect communities are not equipped to be able to respond to their need. And that's what makes it a disaster. And so if we're thinking about really being able to do the most for the least, and we're really thinking about what it takes to make sure that our nation and our world is at a place where we are not continuing to be buckled by these types of events, we have to talk about disasters all the time. And we have to talk about it from the vantage point of not shifting the burden to individuals and communities, but looking at it as a collective responsibility that we have to make sure that our systems can actually take care of people and take care of them in ways that allow for them to thrive and not just barely make it through a disaster.
So let's talk about these disasters beyond the event themselves. Because clearly we have seen with COVID, comorbidities, pre-existing conditions, physical pre-existing conditions, but also social pre-existing conditions that made us exceedingly vulnerable to COVID-19 in ways that we had not imagined. The death tolls from this virus are not equitable racially or economically or socially. And so how do we as a nation actually prepare for such a thing without reevaluating our infrastructure, our human infrastructure, as well as our response infrastructure?
So, one of the things about disasters is that often people will say disasters do not create inequities, but they do expose them.
Yes.
And we focus so much often on the very linear parts of a disaster that we forget that there are so many cascading impacts from a disaster. And just thinking about Janice's question earlier, the number of people who've been unemployed due to COVID, the number of people who've been food insecure due to COVID, the ways that we've shifted into an internet dependent society without remembering that not everyone has access to internet at home, or not everyone has a computer at home, have left people behind. And so as we're thinking about how we recover, we have to understand that COVID was not a baseline. People were already at the community level and the individual level being set behind by decisions that we were making and investments that we made or didn't make in how we were taking care of society. So now that we're getting through COVID, we're looking at numbers like, case rates, and we're saying, people of color were predominantly infected by and killed by COVID. And it's important that we think about the why behind that. It's not that people of color, Black and brown people specifically, were more prone to getting COVID. It's that they were in situations where, due to work or due to where they lived, they were more exposed to COVID because of their interactions with health systems. They were less likely to get tested or waited until severe progression of disease before they went to hospitals, or because they did not necessarily get the treatment that they could have otherwise gotten in a different part of the nation, in a different county. That's the reality of racism in the United States. And so thinking about how we understand the impact of COVID, even just down to why people got infected, why people lost their lives due to COVID, what their lives look like after COVID. Those are society issues, and those are challenges that we have to address, not just from the vantage point of let's get us through the pandemic. And that's why I'm so hesitant to hear this conversation about how do we just get past this? How do we get past this? Because as we rush to get past it, we will leave people behind if we're not intentional about thinking about how we left them behind before the pandemic and what the pandemic has done to their sense of security and stability. What does it mean to go through a pandemic and not have health insurance? What sense of vulnerability do you have when you're thinking about the tension between having to go out and work because you have to take care of your family and knowing that you do not have health insurance? So if you do get sick, what happens to you and who pays for that? And how do you deal with the psychological turmoil that you're living in with that fear of fragility and vulnerability day in and day out? Those are the very practical pieces of what we're seeing, and we're seeing it across the nation. That's not any one person's story. That's so many people's stories.
And thank you for that. That's very helpful. I want to push a little further as this audience is largely pastors and priests. I use priests as in priesthood of believers. We all have accountability. Can you speak a little bit about the mental health portions related to COVID? What happens when people are isolated for 14 months? what happens when people are dealing with death that has not been properly mourned? Or do you have any consultation for us as ministers, as congregants, for what we might expect or should prepare for when we return to church?
I think there is a palpable level of trauma that is what we are seeing nationwide. As a part of the work that we've been doing, we've been just looking across the nation, asking questions about what type of help do you need? What type of help have you sought? Because not every time do people need help, do they seek it, right? And so I think there are many instances where we've seen the faith-based community and community leaders actually stand in that gap in ways that mean that not only are they dealing with their own trauma, they're also absorbing the trauma, the distress of their communities, because they may be the only ones that see that gap. But we have seen from December until May, the number of individuals, to include men over 30, to include Black people, brown people, are actually increasing consistently when it comes to who is seeking mental health services. And what does that tell us, right? What does that tell us as individuals who know that those are communities that tend to be more resistant to seeking mental health services? And that doesn't mean that they're getting the support that they need. That just means that they sought it based on how we're asking these questions. And so we know that there's a collective trauma, there's a collective grieving that everyone has gone through. But we know that in the same way that some communities have experienced the physical impacts of COVID, they've also experienced the mental health and psychosocial impacts of COVID more. What do I mean by that? I know some individuals who may know of one or two people who died from COVID. I know other individuals who've lost whole families to COVID.
Mm-hmm.
And that in itself is tremendous, to think about what the impact of COVID could be on an individual level. And what does it mean to house grief for not just one person in the last year, but for families of people, parts of your village that you have lost and are connected to? How do you do that in isolation? So much of the grief rituals are really intended to help us to get peace for those that are of us that are left behind, and to be able to have that moment of solace, to be able to have that moment and say, this is where we are right now. We are celebrating the life that was. We are recognizing that in this moment, we are left to carry the memory, and we've lost that. We've not had the ability to have funerals and to grieve and just to have that bereavement process. And I think for some of us, that's happened in a magnified way, because it's happened on the scale of dozens of losses. And some of those may be COVID, some of those may not be. I know I personally lost my granduncle 2 weeks ago, and he's in Jamaica. And because he's in Jamaica, my grandaunt, his sister, my mother, his niece, and all of us that are here in the States not only had to know that he was being buried without us, we had to watch the service on YouTube. Yeah. And even that experience of having to grieve separately is traumatic. And so I think there are no ways to fully quantify the amount of grief and mourning and sorrow that people are holding in isolation and haven't been able to fully let out.
This is so helpful. If you have other questions, please bring them, because you know this time goes quickly. I want to bring something else into this conversation. I served as a pastor until December of last year. So most of COVID, I was still in the congregational setting. I had a member who was diagnosed with COVID in October, and she had pulmonary effusion. So she had comorbidities already going on. She is still hospitalized. This is May. From October until May, she gave up a couple of times, and we encouraged her and kept pushing and kept pushing. She's in rehab. I did see her yesterday because she called and asked to see me, and I could not refuse it. And I saw her, and she's looking better, and I believe she's going to make it. But I want you to speak a little bit, Dr. Louissaint, about the lasting effects of COVID, even when you get over the initial part of the virus. There are people who are going to live with side effects from COVID, and how might we be attentive to that?
There are so many long-term impacts from COVID. We have seen individuals that have survived ICU stays of 6, 8 months. There are long haulers who have actually survived COVID, but have pains and aches and the type of physical ailments that are hard to actually pinpoint, but are so disruptive to their lives. Just as two examples of the types of people that we may need to actually support in the months to come and years to come. But there are also individuals who have seen severe disruptions in other types of medical care. I know a number of oncology patients that were in cancer treatment that had significant pauses in their treatment simply because they were not able to get to the hospital, or the hospital delayed their treatment. What does it mean for them? So I think there are so many long-term impacts, and now as we're starting to hear a conversation about the impact of COVID on kids, thinking about what the impact is of not just the children, but the caregivers, and what does it mean for a family to be in different stages of grief or trauma or recovery from COVID, and trying to support one another, but all being at different stages. And I think often we forget that that complicated dynamic of not just being in the place of dealing with recovery yourself, but we're all in some position of balancing the tension between how do we take care of others and help them with their trauma? How do we acknowledge the trauma in ourselves? And for those of us who may be in positions of service in our work, how do we do the work of being able to also support others? So there's this constant tension. And I think that's a part of what makes this recovery so difficult, because at any given point in time, you're either extending the type of grace and support that might be needed for someone to deal with their own recovery, physical or otherwise, or you're in need of it yourself.
Mm-hmm. Mm-hmm. So what advice might you be able to give to pastors and to congregants about post-pandemic preparation for congregations? Is there such a thing that we need to be preparing for? I'm speaking more from your experience with all kinds of tragedies, and this is a tragedy of massive proportion. We last year provided grants, emergency grants to some churches, emergency loans to churches to help get them through. In my estimation, we have not seen the financial impact of COVID yet. We'll see it 2 or 3 years down the road. And how might churches begin to prepare for that? And there's also, I'm going to give, these are not related, but I don't want to lose her question. Alice has this question as a layperson, that she recognizes that many pastors are afraid of going back into the church, bringing congregations back. And yet as a parishioner, there is a longing to come back together and be family. And she's asking, is there a middle ground for returning to worship? And I'm going to speak, perhaps in ways people don't like to hear me speak, but I'm going to caution us to have patience. And you can say, well, we've had patience for 15 months. Don't talk to me about patience. But we have to get to a place as the priesthood of all believers where everyone feels safe. And the theological implications we are faced with now is theologically, is it church if everyone can't come? Is it the community of believers if some are isolated because they literally would be risking their lives to come? We may have to wait just a little bit longer and trust pastors in their individual settings to know when their congregations are ready. That answer won't be the same for all of us. If you're in a congregation where most people are vaccinated, that may be a little different, although you're still coming in from the outside. Trust your leadership on this, because the detriment of getting it wrong is too great. If you'll talk to us, Dr. Louissaint, about what post-COVID preparations we should perhaps have in place.
And I will also say our team has been working really hard on a series of toolkits that are specifically designed for church leaders who are thinking about going back, and what we want to make sure you're thinking about, not just when you re-enter for service, but a lot of churches are also doing a lot of outreach support, community events, food pantries. And so we want to make sure that you have that, and that'll be on our website. We're hoping to start rolling these out on Friday. There's so many dynamics to think about, and you identified so many of them so thoughtfully. And I think, you know, Dr. Blackmon, how you just described the opportunity to explore patience as a virtue that we need to be mindful of, and the opportunity to really explore where the church is. And are we thinking of the physical church? Are we thinking about being the church? What does it look like for us to continue to be the church in ways that allow for that middle ground to be reached? And I love the idea of the middle ground. The website is healthcareready.org. I will make sure you have all of that information. I saw the questions coming in. And so we'll make sure you have that. But I think there are a number of important ways to think about this. One thing that I've seen, a lot of churches have had a grief counseling service going throughout the pandemic, and have really begun to ramp that up, and have started with small group in-person, socially distanced sessions for those who are comfortable attending that, and even offering that in a way that says, we'll have a virtual option, we'll have an in-person option, we'll do it at the same time, but recognizing that everyone is grieving something right now. Opening that grief ministry up in ways that would be, I guess, non-traditional. You don't have to have lost someone in order to understand that there is something to grieve right now. But certainly if you've lost people, you need that. I also think as we've thought about the creative options, hybrid church is difficult. The idea that, you know, you're going to say, okay, these people can come to church this week. I think even for what I'm seeing locally, the idea of opening the doors of the church means opening the doors of the church. And if you are a church where you know that every pew was filled, or you're not going to be able to socially distance, it does get more difficult. It's harder to figure out. It's harder to be able to determine how you do screenings. But then the other part is, how do we actually impose things like temperature checks, sanitizer stations? How do we change some of the practices? I thought about it the other day. I've not taken communion since February of 2020. How do we safely do communion for those, you know, that actually practice? So I think there's so many different layers to it that I think starting in some of the small groups, starting in some of the small ministries, also having alternatives set up so that for people who can only join by phone or are not comfortable coming in person, they're able to do that. And also, before we jump right back into how do we talk about church, how do we talk about how people are going to take precautions in this place? Not everyone is comfortable taking the vaccine. So let's start by having some honest conversations about, if you've chosen not to do that, here are the precautions you need. If you've not made a decision to get vaccinated yet because you feel like you don't have the right information or you don't have enough information, maybe that's the first place where we start.
Kenneth has asked the question, as we head back in-person worship at Pentecost, his community of faith will gather for Pentecost, and they are challenged to extend the extravagant welcome that we strive for. You know, and I want to add to that, Kenneth, that we are living in a time where for 15 months, many people have not had consistent human touch. We are a people who thrive on touch. So how do we return without greeters or ushers? What can we do to help attendees feel welcome? And I think that's going to be an ongoing challenge. It will depend upon your community. I suggest incorporating into your actual liturgical service moments of seeing one another. Invite people to turn and make direct eye contact with one another and really see one another. Have moments of contemplative thought where people can get their arms around what it means to be back in the sanctuary. For some, that feeling itself is going to be overwhelming. We'll have to figure that out as we go. Someone asked in the chat, had I written about this? And I have not, for a particular reason. We are a congregational denomination. We have conference ministers, 30 plus conference ministers, 36 of them actually, who know their churches and know their areas. And our churches are not the same. So for me to speak from the national setting may give information that does not apply to everyone's context. We certainly have churches in places where the virus has not really permeated, where people have not had a problem with COVID. Their response is totally different from an urban environment where people are inundated with COVID. So out of respect for the leadership on the conference level, this is really their place to speak. And I'm just having a dialogue in general terms. Please talk to your conference ministers about it. Suzanne wants to know, how do we impose things when our states are removing all mandates other than the mask? It is getting harder and harder. And it certainly is, Suzanne, but the church still has autonomy. And we have a theological responsibility to do what is necessary to, I say, follow a Hippocratic oath in a theological framework. First, do no harm. We have to do that. So we can be released from a legal obligation of not gathering, but we are not released from a theological obligation of caring for everyone. Final words to you, Dr. Nicolette Louissaint. I wish we had 2 hours because I love talking with you. And it's almost time. So what are your closing thoughts for us?
First and foremost, thank you for everything you do, Reverend Blackmon. Thank you for holding this space. It is so important to have these conversations, and I thank you for the leader that you are. I think there's so much that we have to unpack here, and I think there's so much to figure out that I encourage us to really take the word that you shared, patience, with ourselves and with each other. There's a desire to push past where we are right now. But we are really just at the cusp of the light at the end of the tunnel. We're at the beginning of the end. And so being patient with the process and understanding that we do have a lot more work to do ahead of us, and making sure that we are not inadvertently putting ourselves in a position where we set ourselves back, whether that be because there may be a hurricane that comes sometime soon, we're approaching hurricane season, or because we do not get where we need to get on vaccination. So please, patience, take patience with the process, take patience with yourselves and your communities. And I do believe that we will get out of this someday soon.
We have lots of questions, mostly requests for you to come back, of course, and we need another session. I would dare suggest that I will call out, reach out to you. Perhaps we could do another session maybe in September, after people have begun going back to churches, going back to congregations. We might know a little bit more.
I would love to.
Great, great. Over to you, Roberto.
Awesome. Thank you, Reverend Traci and Dr. Louissaint, for an amazing and important exchange for the wider church. If this hour has inspired you in any way and you would like to continue supporting ministries like this, consider donating to the annual fund by texting UCC to 41444. I'm excited to share a couple of upcoming events. This coming Thursday, for the soul, on May 13th, join Faith Community Congregational of Oakland, California, as they lead us into a very special Filipino-style worship of honoring mothers and matriarchs, a special Mother's Day event for UCC congregations in the wider church. Come and learn more about our Filipino siblings in the UCC as they share their spiritual joy in Christ for all. And on our next Tuesdays for Nurture, May 18th, we will explore the concept of purple church. The United Church of Christ contains people with a wide spectrum of theological belief and political alignment. People who choose to be in a church that holds difference of opinion often do so with a few different strategies of love and conflict management. On this conversation, we will hear from pastors of purple churches or churches that have members across the theological, cultural, social, and political lines, and how they show up authentically with each other in the midst of their differences. And on Thursday, May 20th, join us as we celebrate this year's Antoinette Brown awardees of trailblazing and innovative clergy women who will speak wisdom for the church. UCC Tuesdays for Nurture and Thursdays for the Soul. Digital programs air at 9:30 a.m. Hawaiian time, 12:30 Pacific, 1:30 Mountain, 2:30 Central, and 3:30 p.m. Eastern Standard. Until then, mis hermanas, hermanos, hermanes, siblings, gracias for joining us today. Reverend Traci, will you please lead us out in a benediction for the rest of our day?
I would be happy to do so. If we could just take a moment in honor of all those who have crossed from this world to the next over these last 15 months. More than we can name, more than we can imagine. Whether they crossed over because of an encounter with COVID, or whether there was some other reason that makes the loss no less significant. May we thank God for the power of the resurrection and for the comforter that has come. May we remember this cloud of witnesses. May we learn how to be more caring for one another, more caring of creation, that we don't find ourselves in this place again. Hear our prayer, O Lord. Grant us thy mercy and thy peace. Amen.
Siblings in Christ, if this conversation has moved you, if what's been offered here has helped enhance your ministry or your soul, please consider donating towards the annual fund of the United Church of Christ by texting UCC to 41444. Your support will help programs like this in the essential work of the United Church of Christ. Thank you for your support. Be blessed as you continue your day. Know that you are not alone, and we are holding you in prayer. Amen.